Welcome to LPN LaunchPad's review for medication administration, implementation and evaluation, focusing on applying the 9 rights of medication administration and assessing therapeutic outcomes. Implementation and evaluation matter because safe, accurate medication delivery relies on comprehensive pharmacological knowledge. This knowledge ensures effectiveness and timely therapy adjustments to maintain optimal patient outcomes. Key topics include the 9 rights of medication administration, strategies for minimizing errors, such as addressing look-alike, sound-alike, and high-alert medications, documenting both administration and patient responses, and thoroughly evaluating therapeutic and adverse effects. The main objective of the implementation phase is to safely administer medications by following the 9 rights, thereby minimizing errors and protecting patient safety at every step. The 9 rights are the right patient, the right drug, the right dose, the right route, the right time, the right reason, the right documentation, the right response, and the right to refuse. This review will explore each in detail. The right patient requires verifying 2 identifiers, name and birth date, or name and medical record number. It also requires double-checking wristbands without relying on room numbers alone, an essential step the NCLEX frequently tests. The right drug involves comparing the medication label to the order 3 times while preparing, being vigilant about look-alike, sound-alike drugs, for example, hydroxyzine versus hydralazine, and performing a second check for high-alert medications like insulin or heparin. The right dose emphasizes verifying the prescribed amount, accounting for patient-specific factors such as weight-based dosing or renal adjustments, and double-checking high-risk medications like opioids, anticoagulants, and insulin to prevent overdosing. The right route means confirming the correct mode of administration, oral, IV, IM, subcutaneous, topical, and so forth, and assessing the patient's capacity to tolerate that route, especially the ability to swallow oral medications. The right time involves maintaining accurate intervals to preserve therapeutic drug levels, considering drug half-lives, and watching for food-drug interactions. This is particularly important for narrow therapeutic index medications like vancomycin or warfarin. The right reason prompts verifying that the medication is consistent with the patient's clinical condition, questioning any order that lacks a logical correlation between the drug's indication and the patient's diagnosis. The right documentation calls for promptly recording the drug name, dose, route, time given, and patient response, including any delayed or missed doses with relevant justifications, because documentation supports continuity of care. The right response entails monitoring whether the medication achieves its intended therapeutic goal while remaining alert to any early side effects or adverse reactions. Documenting these observations is crucial for ongoing patient assessment. The right to refuse means acknowledging that patients reserve the choice to decline medication. Nurses must educate them about the implications, document the refusal, and inform the provider if it potentially compromises safety. The next phase, evaluation, centers on determining whether medication therapy achieves its intended effect and identifying or managing any adverse outcomes that may require intervention. Compare actual outcomes to planned goals to judge the effectiveness of medications. For instance, a patient with hypertension might aim for a blood pressure of 120 over 80 millimeters of mercury. An infection should expect a normalizing temperature and white blood cell count, and a patient in pain might target a decrease on the pain scale. Nurses must also identify any side effects or adverse effects, from relatively mild, like GI upset, to severe, anaphylaxis, Stevens-Johnson syndrome, hepatotoxicity, promptly stop the medication, assess the patient, and notify the provider if severe reactions arise. NCLEX practice. Question 1. A nurse is about to administer insulin, a high alert medication, to a patient with type 1 diabetes. Which action best reflects adherence to the right dose principle? A. Using a 3 milliliter syringe to simplify calculations. B. Trusting the pre drawn insulin pen from another shift. C. Administering 10 units without checking blood glucose. D. Asking a colleague to verify the dose before injection. The correct answer is D. Ask a colleague to verify the dose before injection. Insulin is highly alert and requires an independent double check to ensure accurate dosing. NCLEX. Practice. Question 2. Which patient statement indicates an understanding of the right reason for warfarin therapy? A. I'm taking this to control my blood sugar. B. It helps thin my blood to prevent clots. C. It keeps my blood pressure from going high. D. I take it for migraine relief. The correct answer is B. It helps thin my blood to prevent clots. Warfarin is an anticoagulant used to reduce clot formation, so a patient's awareness of that reason aligns with the right reason principle. NCLEX practice. Question 3. After administering an IV antibiotic, the nurse notes difficulty breathing, hives, and periorbital swelling in the patient. What is the best initial nursing action? A. Call the pharmacy to confirm the dose. B. Discontinue the IV infusion immediately. C. Give the next scheduled dose at half strength. D. Document the reaction in the patient chart. The correct answer is B. Discontinue the IV infusion immediately. The patient's symptoms suggest an anaphylactic reaction, so it is essential to stop the injection and then proceed with further interventions. Key takeaways emphasize meticulous application of the 9 rights to avoid errors, detailed documentation of medication administration and patient responses, prompt identification and management of adverse effects, and ongoing evaluation of therapeutic outcomes, elements the NCLEX frequently assesses. Please feel free to post any nursing school related questions in the comments. I will also challenge you to improve your learning experience by discussing best practices for high risk meds, dosage calculations, and real world experiences with fellow viewers. Finally, supporting this channel with likes and subscriptions helps keep resources available. Hey there, this is Brian, the creator of LPN LaunchPad. I aim to give every student a fair review for the NCLEX for free using YouTube videos that can be watched or listened to without losing value. It may be free, but it is still valuable. If you find these reviews helpful, help me keep this project alive by hitting the like and subscribe buttons and continuing to watch my videos. Also, check out the free ChatGPT NCLEX review quizzes I have made to accompany these videos. A link is in the description or search for LPN LaunchPad in the Explore GPT box. This review has been an LPN LaunchPad production. We care for our future nurses by freely sharing knowledge.